everyone. Welcome to Osteo, that's with a capital TEA, where osteo warriors in treatment and recent survivors spill the tea on all things osteosarcoma and cancer from the adolescent young adult patient perspective. Listen in on our honest and personal conversations about our osteo experiences, stories, and who knows what else. We like to get off track a little bit. This podcast discusses all aspects of the young adult cancer experience in a conversational format. Audience discretion is advised. Like and follow MIB Agents on social media for all the intel and hot goss. I'd also like to remind our audience that we are not medical professionals and that we will be talking about our personal patient experiences with long-term side effects today. So, in exciting news, Factor 2024, who's going?
I'm going. I'll be there.
Yay! I unfortunately have to miss it this year, which I'm really bummed about. But it is going to be absolutely fantastic. It sounds like the best one yet, and the others were already hard to beat. So it's going to be June 20th through 22nd in Cleveland, Ohio. Registration is $335 for individuals and free for osteo warriors ages 8 through 22. There are going to be scientific sessions, Warrior HQ, there's a wellness track with super fun activities, there are therapy bunnies, and what more could you really ask for? It's a fun time and you don't want to miss it. And Sammy, why don't you tell us a little bit more about the highlighted activity?
Yeah, so this year we're going to be doing a factor prom, which is kind of exciting. I mean, I am in class of 2020, so I didn't get a prom. So I'm probably more excited about this than maybe other people are. But the theme is supposed to be really cute. It's like the Enchanted Garden. I think it's going to be dancing. And, just because we're disabled doesn't mean we can't dance, because I can get down.
True.
And But yeah, everyone should come. It's supposed to be really fun. There's a lot of planning. There's a meeting today to go over the planning, so it's really exciting. A lot of people are really excited about it, and it should be really fun.
That is awesome. And don't forget that um, if you have registered for Factor, your ticket to prom is already included and you can bring a plus one. So very exciting. So you can bring a date, maybe a little promposal planning happening behind the scenes. Who knows? Prom attire is encouraged for all ages. The ticket is valid for June 21st. There's going to be dinner with wine and beer selection from 6:30 to 8:30. And then actual prom and dancing will be from 8:30 to 10 p.m. with a cash bar. And there will be a silent auction. And you know, we always have good stuff up for grabs. Also at Factor this year is going to be our ambassador agent training, which will take place live at Factor in the Hotel Cleveland on Thursday, June 20th from 9 a.m. to 4 p.m. with complimentary lunch. If you are an osteo warrior or caregiver of an osteo warrior who has been out of treatment for a minimum of a year, we will be happy to welcome you to ambassador agent training. I highly recommend the program. I unfortunately have not hit that 1 year milestone, but the program is really incredible and does absolutely awesome things. And check it out on our website if you have any interest. So, welcome back, everybody, and welcome to our newcomers on the podcast. And it's time for our favorite and only typical segment. What's the tea? No, like literally. So, we're going to go around and share what bevy we're drinking and give a review and a rate of it. And while you're at it, just do a quick little what your name is, introduce yourself, how old you are, where you're from, what you're up to, if you're in school, if you're not in school, if you're just vibing, I'm just vibing. Just a brief history of what you've been through and what your bevy is, and I'll start. So my name is Mia. I am 25. I live in LA with my mom and our two dogs and five cats. It's a little hard to keep track of, but lucky seven, lucky number seven. My mom was joking when I told her the name of this episode that my long-term side effect is that every time I have a near-death experience, I want to get another cat.
That's valid. Yeah.
So if you do the math, it's been three new cats since I was diagnosed. So let's so there's that. A lot of you know I have a limb salvage from my right proximal tibia, so I call him Rodney. We have a love-hate relationship, but he supports me the best that he can, and no relationship's perfect. I am currently drinking lavender chamomile tea with probiotics because gut health is important. And because it's really hot in LA today, it's cold. So, because it's not hot and because I run hot, I'm gonna give this a solid 8 out of 10 because I know that sometimes talking about long-term side effects can bring up some prior traumas. So I figured it might just be nice to have some, lavender and chamomile on board just to take a deep breath and self-care and all that good stuff. But Sammy, why don't I toss it over to you?
Yes. So my name is Samantha. I go by Sammy. It's a little less formal. I'm 21. I'm from Victorville, California, so Southern California. Right now, I'm currently pursuing a degree in biology and just vibing, you know? I don't have too much going on besides that I'm moving, but I'm actually moving closer to where I was treated because it's kind of a drive to get to Loma Linda. And so we're going to live closer in that area, which is kind of nice. And I was diagnosed with osteosarcoma in my right tibia in August of 2022 when I was 19, just like a couple days shy of my 20th birthday.
I was 19.
I underwent, yeah, around the same time, yeah. I underwent a limb salvage surgery, my right leg. I have an internal prosthetic. I have not named it yet, but I feel like it's a she. You know, when I refer to my knee, I'm like, oh yeah, she hurts a little bit today, but I do need to name her because you have a cool name for your knee. Um, and right, oh, and sorry, I haven't finished. So I finished treatment in May of 2023, and I'm a couple days shy of being a year out from treatment. So that's exciting.
Congratulations.
Thank you. On May 7th. We'll see it on Instagram. I'll post about it because I'm my biggest hype woman, you know? And I'm drinking a lemon tea and it is hot, but it's hot in the area right now, but I made it hot anyways, just because I have a hard time drinking cold tea.
Mm.
But it's good, but it kind of tastes like something I drink when I'm sick. So I'd give it maybe like a 7.5 out of 10. But I like my mug. Look, it's Winnie the Pooh.
Oh, I love it. Well, I
Yeah.
respect it. A 7.5 is a good score.
Yeah, it's pretty decent. It could be better though. And then I don't know if Mackenzie wants to go next.
Sure. My name is Mackenzie. I'm 17. I'm from Arkansas. My cancer showed up in 2020 at the end of the year. My first chemo was like 2 days before Christmas, and I barely got home for Christmas, which was fun. When you have cancer, you miss all the holidays.
Yeah.
I finished treatment in September. I had some heart problems from chemo. Still dealing with that today, which we'll talk about later. But I do virtual school, and that's about it. Sean, you want to go?
Sure. Yes. Mackenzie, what are you drinking though?
Oh, yeah. I'm drinking tea out of my Disney villain mug that I just
Oh,
got.
That's
who's your
cute.
favorite?
I don't know. I like all of them. I got it from New York a couple weeks ago. They have a Disney store there.
Nice.
That's cool.
I'm originally a New Yorker, so I appreciate it. Sean, what you
Yes.
got?
My name is Sean. I am 21. I'm from Tampa, Florida, but currently I'm residing in Tallahassee, Florida, because I go to school at Florida State University, studying choral music education. So I'm coming up on like my last year. In a week, I start doing a summer semester again. So it doesn't. I think that's my first last day that some people like to say. But I was diagnosed with osteosarcoma in 2020 in January 28th. So I'm coming on 4 years since it was last week was my 4 year mark for my limb salvage surgery, which happened in April. And then coming up in October would be 4 years since my last chemo. So I'm doing pretty good. I'm grateful. My leg is like pretty bad at what it does. So, but and we're gonna talk about that later, right? Um, but overall, I'm grateful and I feel good. And school is busy, but keeps your mind off all the goofy chemo stuff.
Yeah.
So, today, so I'm not a tea drinker. Mostly, I think my mom drinks a lot of sweet tea, but like I don't know. We live in the South, I guess. Anyways, so if someone was like, what's your caffeinated beverage? It's definitely Monster Energy drink and then coffee. So tea is kind of foreign. But I asked my girlfriend to make she drinks tea, so I asked her to make me tea. So I have brought the package. It is a Imperial Himalayan white tea,
Ooh, I love
and
white tea.
it has honey. I think it's vanilla honey and sugar, and it's a solid like 6 out of 10. I'm not. It's pretty okay. It tastes like water. I don't know.
That's essentially what
Like
tea is. It's flavored
it's a
water,
little
and that's
sweet.
okay.
I don't know. But I also was like, is this cup? I don't even know. It says "Sink it, Dink it, and Sink it," which is from Mythical Morning, I think. I don't know. So she hooked me up. I feel bad because I'm trashing her tea on the podcast, but you gotta give the honesty.
Hey, honesty is always appreciated in a relationship. That's how Jesse and I are still going strong. Um, all right. So thank you everyone for your wonderful little reviews and little tidbits about yourself. And let's just dive right on in because I know that this is an important one. So let's start out a little bit on the simpler stuff before we dive into the heavier stuff, just kind of ease our way in. Um, do you all feel like you have experienced fatigue more than you did before your diagnosis? Like I was diagnosed in September of 2018, so it's been quite a while. Obviously, I was 19 then, I'm 25 now. Um, so I definitely feel fatigued. I feel like that's one of the biggest ones that I have. I don't have nearly as much energy as I used to, and I can't pull information out of my head as quickly as I used to. And I just constantly kind of feel like that heavy eyelid feeling. And it's not just the meds that I'm on. It's something that definitely changed after so much chemo, so much treatment, so much immunotherapy. And I feel like just all the other side effects kind of build on each other. And then, like, we all have the same 24 hours in a day, but there's more that we have to deal with than others sometimes. So energy levels can be down, I found. But yeah, I mean, I'm not as tired as I was during treatment. I would definitely say that. Nothing hits like that IV Ativan and Benadryl combo. Um,
Yeah.
Instantly knocks you out. Like seriously, melatonin who. But yeah, no, I definitely still feel that fatigue after. And what about you guys, Mackenzie? We can start with you.
I definitely had like chemo fatigue, and then my heart stuff happened, and we weren't sure if it was like still from chemo because I was out of chemo by that time, or if it was like heart fatigue from the heart failure. So it was just like a blurry line.
Yeah.
And then we finally got something that like kind of helped my heart, the LVAD, and I kind of gained my energy back mostly for the most part, which was really nice.
Well,
So I've kind of like moved past the fatigue in a way.
yeah. What about you, Sean?
Yeah, I definitely experienced a lot of fatigue. I feel like so I was very active before chemo, and I'm still relatively active. I don't do as much anymore. So I used to mountain bike, and I used to do a lot of like musical theater, and I used to do ballet. So I used to do a lot of stuff. And I definitely feel like even I don't do anywhere close to that. And if anyone's familiar with Tallahassee, it's like the one place in Florida that like has hills, and they kick my butt all the time. Like walking around campus is like a slog. It feels like a lot of time. But mostly I do get that like cloudy feeling. I feel like I'm like chugging energy drinks all the time. It's probably not, maybe that's a caffeine thing, but it's also um I definitely it is way different from what I experienced like before chemo. And I was 16 then, and like now I'm older, and I still feel like at this time I should be in like my prime, I guess, like as like a young adult. But I get it. That's the biggest thing is like so I'm an education major, so we do a lot of like working with the schools in like a local area around the campus. And like I get back from teaching for like 3 hours, and I'm like, man, I could take a really long nap, but I got classes to go to. But yeah.
Well, that's when energy drinks really come in handy. Sugar-free Red Bull is one of my
Mhm.
personal favorites.
Yeah.
Even though caffeine can give me headaches because we are a migraine family, runs in our family. The only thing that runs in our family at this point, because I definitely can't. So, um, Yeah, Sammy, what about you? Fatigue during treatment, after treatment, both?
Yeah, so obviously during treatment it was a lot more prominent, but now, like similar to Sean, I was pretty active before I was diagnosed. I was actually a Division 1 cross country runner, so I was always doing something. And then like it's just a different type of tired, I guess. Like now I'm about a year out from treatment, but sometimes I still feel like I can't keep up. Like my social battery sometimes isn't always there. And like Sean said, like we're supposed to be in our prime, but like I don't feel like it. I don't feel like it. I feel like I'm pushing
I
50. My joints hurt, my back hurts, my head hurts. I'm tired. I can nap on a lawn, on a bed, on a driveway, like you name it, and I will fall asleep there if I'm tired enough. And that used to not happen prior to treatment. So
Yeah, no,
yeah,
I was the
yeah.
exact same way. I was not a napper, even as a kid, was not my thing. I was doing Pilates 3 to 4 times a week, going to the gym 3 to 4 times a week. I had dance 2 to 3 times a week, only for the PE credit because I hate running. But I was not a good dancer. But I wasn't dance for 4 years in high school. And that's still a lot of movement. And I would also do home workouts on top of that. And then when I moved up to Seattle for my freshman year of college, which is um, when my tumor was growing, but I didn't know that. Uh, UW is in Seattle, which is also very hilly. And obviously, it also gets cold and rainy. So it's a bunch of wet bricks and falling leaves. And so it is the epitome of a trip hazard. Uh,
Mhm.
and it was very different because I had the opportunity to go back because they said I was in remission. And then unfortunately, my cancer did come back and has not gone away since. But I did get, like a 7 month break where I went back to school and it was very bizarre. It was definitely weird going from being a fully able-bodied 18-year-old who was in the best shape of her life ever. I mean, I don't think I can ever get back to that point
Mhm.
now. Um, and how, I was walking 3 to 4 miles a day, living on the third floor of my sorority house. Laundry is in the basement, so it's a 4 story, compound type thing in a house of 95 girls. I mean, it's a lot. And so
Mhm.
I was able to do that. And once I went up after treatment, it was so different. It was so
Mhm.
different. The levels of tired. I couldn't do full-time classes anymore because my brain fog was so bad.
Mhm.
So I did part-time, but cancer kind of gave me a new lease on life, emphasis on lease because it's not a buy, it's not a forever thing, it's
Mhm.
it's a year by year thing essentially at this point.
Yeah.
You never know if you're gonna get to extend that lease. But getting off track. But anyway, yeah, it's hard
Fatigue is
adjusting
awful. Yeah. I fell
the
asleep at
new
a
normal.
Chili's one time because of fatigue. So, and I love Chili's, and I fell asleep, head on the table, I was out. And
I mean,
before
hey,
treatment, that wouldn't happen. That wouldn't
that's how
happen.
you know. That's how you
Yeah,
know.
that's how you know.
I definitely, uh, I tell my friends all the time. I was like, I feel like I'm like a 50-year-old geezer. Seriously.
Mhm. Oh yeah. I think it's we've all been aged a lot by chemo and stuff and
Significantly.
treatment. Like
Yes.
I'm tired. I'm ready to retire, guys, and I'm only 21.
It's exactly
I
how
always
I
call
feel.
myself a grandma because I was the walker all the time and the cane
The
and
cane, yeah.
my hair whenever it was growing back is like grandma hair. I was like, oh my goodness, I'm a grandma.
Yeah,
Yeah.
it's how do you even avoid the mother of the bride hair? That's what I call it. You know what I mean? Where
Yeah.
it's like it's
Yeah, it's tough. It's tough growing out your hair. Yeah. It's
yeah.
very humbling.
Nice.
Very humbling. Yeah.
My poor mom, this is another I guess you could say it's a long-term side effect of a caregiver. My poor mom, she is a saint. She's the best. She's essentially my best friend. I love her very much. And obviously, she's been with me through everything, and I've lost my hair 3 times. So I just got a haircut recently. It was more like here, a few weeks ago, and I just wanted something, a little bit off my neck for the summer because I get really hot. Um, and I got my hair cut at home because we have a family friend who does hair. And my mom opened the trash can, not realizing that we had swept up the hair and saw all my hair in the trash can and immediately freaked out. Just because it was so, she's like, we've been through this multiple times where you lose your hair. And so she was
Yeah.
the rest of the day. I'm like, I'm so sorry, but the haircut's cute.
The trauma is real, like for
Yeah, I'm like,
family
"But
too, not
thank
just for
you."
us. Like, oof, yeah.
I think she might still have a bag of my original hair. somewhere in this house. I'm
I
surprised
used
one of the cats hasn't hunted it.
I used to like before I was even diagnosed, when my hair would fall out, it's really weird. I would make a little ball. So I had this like hair ball, right? And I was
Mhm.
diagnosed and all my hair fell out. And I was looking through my college boxes and I found my little hair ball and I was like, dang, good thing I kept it because I don't like so I have a little hair ball from like before. And it's so gross. And my mom's like, throw that away. But I think it's funny. I display it.
Hey,
Yeah.
keep whatever you want. It's your cancer experience and nobody else's.
Yeah.
I think it's funny because I used to actually add my little hairs to it. It's pretty big too. I should have brought it. I showed you guys.
You should have. We should do a show and tell episode.
Yeah, you don't like
Um,
ew and then block me from the podcast. Okay.
When I was losing my hair, I wore ponytails every day. And when the hair had nowhere to go, it just got so matted. And we were like, okay, we finally have to shave it off. It was like so bad. My mom couldn't even bring herself to shave any of it off, barely any. It was bad, but it was
Yeah.
traumatic for sure.
I
But
hope
look at us now, beautiful heads of hair.
Yep.
Who would have thought? Not me.
I hope none of you ever have to lose your hair again, but for anyone in our audience, if you are about to lose your hair, after you kind of shave it or buzz it, what I would recommend doing is a couple times a week because little hairs get scratchy and you're still going to have those little hairs falling out and it would drive me crazy. And my friend Erin, who unfortunately passed away this February, this was a few years ago that she told me this. She said to take a lint roller, that you would use to get like pet hair or something off,
Yeah.
and lint roll your head. And let me tell you, that worked so well. And I have like a video. I'll see if I can find it at some point and I'll show you guys after we're done recording. But let me tell you, it was really funny just with my mom and I just lint rolling my head and the cats had no idea what was going on. It was very amusing.
That's
But
so
it
smart.
is,
That's really
yeah,
smart. Yeah.
it worked really, really well. And I didn't have that itchiness of hair falling out constantly. So
I used to use
highly
tape.
recommend it.
I would put like duct tape around my hand and then I would like tap my head. But the lint roller sounds a lot better. Yeah.
It is a little bit, you get a little bit of a massage, you just kind of,
Yeah.
it's,
My
it's
head
like,
would stay
it's
would
like,
be sticky afterwards. So I don't
yeah,
recommend duct tape, but that's what I would do.
maybe
Luckily,
more
my
like an electric tape or a painter's tape.
luckily my father was bald already, so he knew the tricks of the trade.
Dang.
That was always an interesting experience when we'd be, at the hospital I stayed at, we had two beds. They were like two bedrooms, but like immunocompromised and all that fun stuff. So it was like just us. So we'd be staying there overnight, and it'd be like one bald head and then like another bald head. And I think nurses would come in and be like, "Who's the patient again?" Like, that was a fun joke for him. He would get a kick when he watches this. He's gonna get a kick out of this.
That's
Oh,
funny.
I'm sure. Shout out to Sean's dad,
Shout out to Sean's dad. Yeah, that's pretty
a
funny.
fellow member of the bald community. Um,
Uh-huh.
so before we get too off track, because I don't want to take up all of your precious time because you guys all rock. Uh, Sammy, this is more directed towards you.
Mhm.
And this is something that I experienced as well. So, did you go through the MAP protocol?
Yes, I did.
Okay.
Yeah.
Yeah, the MAP protocol, for those who don't know, is methotrexate,
Hmm.
adriamycin, which is also known as doxorubicin, also known
Hmm.
as devil,
The
and
Red
also
Devil, yeah.
cisplatin. And cisplatin is what
Hmm.
I'm going to be talking about here. So a common side effect of certain chemotherapies, not just cisplatin, but cisplatin is very commonly used for osteosarcoma. One of the side effects is hearing loss in some patients. And I remember after my first dose of inpatient chemo, I was home, I slept in my mom's room, and I got home on the Thursday, and I woke up the Saturday morning and I heard barking. And I was like, oh, that's weird. I didn't know our neighbors got dogs. And then I got up to, and this is a little bit TMI, but I got up to pee, and everyone knows the sound of pee hitting a bowl, especially your own.
Hmm.
And it was off pitch. And I was really confused. And that's when I realized that the dogs barking outside were our dogs, but they didn't sound like our dogs. And that's when I realized that I had lost some of my hearing and that loud noises suddenly became like my ears were so sensitive. My dad does that annoying dad whistle, you know, where they put their fingers in the mouth and the whole like loud, like, no, I hate, what is the point? We're not at a baseball game. It's someone's birthday party. We're inside and no, don't do that. And he's done it next to me multiple times. I swear I've almost cut contact because of it. It hurts so bad. And so my ears just became so sensitive, and I went to the audiologist, and they were like, yeah, with the cisplatin, this can happen. You've lost about 15% of your hearing. And my oncologist said, well, I'd like to keep her on this chemo if possible. However, we'd probably have to get her fitted for hearing aids if we do. And I said, well, is there another drug that we could swap in? Um, and that is what we did. So I only did one round of cisplat, and thankfully I have regained, just because thankfully we are young, you know, we do have a decent amount of neuroplasticity that doesn't usually drop off till our mid to late 20s. So thankfully I was able to regain some of my hearing back, but I still have problems with really loud noises and the cocktail party effect, which is where when you're in a loud environment and you're trying to focus on a conversation, that is much harder for me. However, it has made me a much more skilled lip reader.
Yeah.
And that has really helped. But Sammy, I'd love to hear, you know, your experience with your hearing loss, and when did you first notice an impact on your hearing, and what adjustments have you had to make?
So I noticed pretty early on, I had, like you said, like the three doxo, cisplatin, methotrexate, and they had told me that cisplatin would affect my hearing. And I was like, no, like that's not gonna happen to me. Like you never think it's gonna happen to you, but then it does. And I think a couple months into treatment, um, you know, the IV pumps, they would like they started to sound different. And then when people would like come to talk to me, and like the cocktail party effect, if like a bunch of my doctors were there talking, I would have a really hard time kind of like I had to watch their lips. And like how you said, like I'm a lot better at lip reading. And now I'm about like a year out from my treatment. And I would say about like 3 months ago, I started noticing that the ringing in my ears was getting louder. And now if people talk to me and if I have my back to you, I can't hear you. Like I have to turn around and actually look at you. And so recently I went to an audiologist, and they actually kept me on cisplatin. Even though I mentioned that my hearing was kind of going, they decided to keep me on it because like my tumor was growing, and they were like, we really shouldn't alter your treatment right now. So I kind of just toughed it out. And then after treatment, it wasn't that bad. It kind of went away. And then recently it's gotten worse. So I went to the audiologist, and I knew it was bad from the jump because I was sitting there, and I guess the test started, and I was busy playing with a thread on my pants. And then in my ears, the guy was like, oh, like we started, like, can you hear that? And I was like, oh, can we start over? Can we try again? Can we run that back again? And then yeah, I had to raise my hands, and it was just really difficult. Like that was a really tough test. Like I was this test I didn't study for, you know, I didn't know what to expect. And then they were having me repeat words back to them, and I guess it didn't sound
Done that test.
right or something. Yeah. And then the the person running the test came in, and he showed me the results from like my last audiology exam to this one. And my hearing had decreased significantly. He didn't give me a percentage, but he was like, it's concerning, girl, let me tell you. And I was like, you're concerned, I'm concerned, I can't hear anything. So then he said he was going to send me to an ear, nose, and throat doctor, and I just got the referral for that. So I'm in the process of meeting with somebody to see if I need hearing aids, need to get fitted for them, or see what the best option is. Yeah. So that's kind of where I'm at. But simultaneously, I also got a referral to like a psychiatrist, right? And I was like, who did that? Like, I thought I was pretty sane. Like, I've been, like, the voices haven't been so loud, you know? But then I remembered when I was talking to the audiologist, I made a joke about the voices, and he kind of like didn't laugh. So I was like, oh, he probably put in the notes, like, she needs to see someone. So soon, yeah, I'm gonna end up with hearing aids, grippy socks, a straight jacket. I don't know.
Well, the good news is you're not seeing people. So
no, just hearing them, you know, just
but we see you. I just want you to know that. We see you and we hear you. And that was the perfect opportunity for you to go, what? But
okay, thank you. That's reassuring.
No, it's a bad joke. I'm kidding. But yeah, you know, it really is hard, especially because, you know, we are in our early 20s, I guess me, mid-20s, don't like that quarter life crisis vibes. Even though it's definitely not a quarter of my life, it's definitely 25 is significantly more of my life than that. But yeah, it's hard because I want to go out with my friends and
Mhm.
I want to be in those loud social settings and I mean you're from Victorville, you know how easy it is to get to Vegas from SoCal.
Oh,
And
yeah.
you
I
want to go and
mean,
you want to have fun, but also then it's like I can't really stand in lines. And then on top of that, the hearing's hard. If the music's too loud, you're just gonna get annoyed. It's gonna hurt your ears, and then you
yeah.
can't hear what your friends are saying, and it's just not as fun.
Mhm.
And it's
Yeah, like I'm at an age where I want to go out with my friends, or like I like going to concerts and stuff. And now I realize that when I do, like I have to be really careful. Like I have to wear earplugs to kind of protect my hearing. Or if I go out with my friends, a lot of the time they'll be having conversations, and I know they don't like mean to, but they'll turn away a little bit, and I'm not following. So I kind of just stand there and I vibe and I dissociate, and I talk to myself. The voices, that's when the voices talk to me. So I'm never alone. But or if I'm sitting in the car and they're playing music and I can't hear the conversation, I kind of just look out the window and it is what it is. But it affects like every aspect of our life, even like getting an education,
yeah.
um, like going in person and stuff to my classes. I have to sit pretty close, first of all, to
Mhm.
be able to hear. And then for the online classes, it kind of makes it difficult sometimes too, especially if the professor doesn't turn on their camera. I'm like, I'm begging, please.
Oh,
I need to watch you. I need to see you speak the words. I need to see you because if not, I don't understand it. Then my notes don't make any sense.
yeah.
So it's pretty difficult. And I'm hoping that if I do need hearing aids, they also said that there's like a surgical procedure that they could do, but obviously they need to further evaluate me before deciding what the best option is. But it impacts every aspect of my life. Even right now, the Zoom, like my volume is really high, guys. Like I need you guys to yell at me. I need to feel your voices so that I know that I can hear it.
How's this?
That's beautiful. We should do an ASMR. That should be another
Osteo ASMR, just every
osteopath.
abbreviation ever.
Yeah.
Uh, yeah, so I mean, hearing is obviously crazy. I mean, there are so many long-term side effects when it comes
Mm-hmm.
to chemo and treatment. And I know Mackenzie, another long-term side effect for MAP. I know was it well, it's your story. You told me that you've been suffering from cardiomyopathy, and how is it found, and do they kind of know which one is the culprit?
We know it's doxorubicin. I
Yeah.
think at the beginning they said, you can have heart problems down the line with this one. I think we didn't do my last one because we caught the cardiomyopathy, and we caught it because we did echoes every time before we did doxorubicin, I'm pretty
Mhm.
sure. And then after chemo, it was pretty stable. It was like my heart function was worse, but it wasn't getting even worse until like a year uh, after chemo, maybe a few months after that, was in October of 2022. I had some surgeries on my leg in August. My initial surgery site got infected on my leg. So we had to clean that out with 2 surgeries. And then, like a month later or two, I had another surgery to reconstruct it all. And I was sent home. And then 2 or 3 days later, I woke up in pain, a little bit of leg pain, and then a little bit of chest pain. So we called the on-call people, and they're like, "Chest pain, you got to go in." So we went to the ER. They were kind of running around. They wouldn't tell us what was going on. We were there at like 3 in the morning, maybe 4, and we didn't get out until like 8. But they got this echo done, but it didn't really work. Like they didn't see what they needed to see, and they just knew they had to send us to Little Rock because they couldn't deal with it. They didn't have like this specialties and things at the little sister hospital, basically. So they sent us to the big sister hospital in a helicopter, which was fun, but I slept most of it, so didn't really experience it. Not sure if I should have been sleeping then, but we got there. I was in 4K, which is the hematology oncology unit. And we had a heart doctor come in and do my echo. And he's like, "No, we're admitting you to our floor." So we went to the heart floor. And then that's when I was diagnosed with end stage heart failure. That was crazy. I don't remember much from that, but I remember getting my arc line, which is the thing they put in your wrist. They sew it in. It's like, uh, tells your blood pressure basically. And I was awake for it, which was not fun. Well, I was asleep at the beginning, but when she started sewing that in, I was like, "Girl, Are you trying to kill me? What are you doing? You need to stop. Can you stop? But that's about all I remember from that part. And then I got onto heart meds, which helped a little bit. And we started talking about options. I wasn't eligible for a heart transplant because of the cancer. I wasn't 2 years out yet. So we had some waiting to do. And then we needed to think about long-term solutions because I still had like maybe 10 months to get to that point. So we started talking about the LVAD, which is left ventricular assist device. It basically would pump my heart for me. And then we decided to get it because they were like, you might not get to your 17th birthday if you're just on these heart meds. So we were like, okay, we'll do what you say. And so we got it, and everything's been magical and wonderful since then. I actually got out the hospital, which is kind of uncommon for kids with LVADs. So trendsetter, I was the first in my hospital to go on the LVAD. To be fair, I was only the second person in that hospital to have an LVAD, but still, I received that award. So
break that glass ceiling.
You're slaying, slaying. Yeah, that's called girl bossing.
Yeah.
Yep.
You know, but and sometimes we girl boss too close to the sun, you know?
Yeah, that happens.
None of us are immune to Icarusing it. So
Yeah.
and
I'm sure Sean girl bosses too. Everyone girl bosses.
Yeah.
Everyone girl bosses.
Yeah.
Gaslight, gatekeep, girl boss, you know, I mean, those are the three pillars of society.
The Holy Trinity, you know?
Holy Trinity, yes.
I was talking about New York earlier. I went because of my heart. I got like basically awarded on this draft team thing, and one of the girls that I met there, she's like, the only thing we had to do was have heart problems, and I'm like, girl, that's so true. Like all we had to do was get sick.
That's
big deal.
And I'm so glad you said that, because I feel like, especially with, and again, there, I don't have anything necessarily against warrior terminology. I know that MIB uses it a lot, and I get it. It's, if you don't just want to call people patients, that's too clinical and it's not personal enough. And you know, they want to hype us up. They want to make us feel strong. And the thing about, you know, having cancer is you are essentially the weakest you have been, but people are just like, oh, because you're going through something difficult, you're immediately strong. And it's like, okay, well, have you considered the fact that I was a strong person before this? Have you considered the fact that my diagnosis does not make me who I am? Even though it impacts me, it doesn't, you know, dictate who I am as a person. Yes, I've had to make changes to my day-to-day life, but that doesn't make us different in any way, shape, or form. And sometimes it feels a little bit silly getting achievements or awards for what we've done. And obviously, we are all here sharing our stories, which not everyone can do. So I applaud you all, first of all, for having, I know I shouldn't be using this word, but the strength to share your stories, because I know that medical trauma is very heavy, as someone who is, you know, essentially 6 years into this whole osteosarcoma thing. And Camille couldn't be here today, but you know, she's 10 years in, and it's just crazy how difficult it is, but how we don't have any other option.
My thing was the word when people would tell me that I was brave, like I didn't feel brave. I was fighting for my life, you know, like it wasn't, or and they're like, oh my gosh, but you're an inspiration, everybody, you're an inspiration. Like I'm not trying to be an inspiration, you know, I'm just trying to make it to next year. And I think the whole strength thing is big. Like you don't feel strong. And I know people probably don't mean it in malicious ways. Like,
no, never.
like maybe it's difficult to find the right words. Like I don't think there really is anything you could say to someone going through what we went through and what people are currently going through that'll make you feel better. But it's just, it's difficult. It's tough.
That's the number one question I get from people is, you know, you know, I'll get Instagram DMs, or, you know, and that's part of the beauty of this podcast is, you know, even though we don't necessarily have the biggest audience, we are hitting our target audience, which is people and families who are impacted by osteosarcoma or have an AYA cancer patient in their lives. And so, you know, I'll get DMs sometimes, and people will be like, well, you know, my friend was just diagnosed. What do I do? What do I say? And I'm like, there's not necessarily things I mean, there are things you shouldn't say, like this happened for a reason. You know what I mean? Like throw that shit out. But you know, but in terms of just treat us how you always did and just
Yeah.
be more conscious and listen to us about the limitations that we have, either from these long-term effects, from the short-term effects. And it's really just treating everyone with respect and being a good listener and caring. And that takes you all the way. I mean, that is how
Mhm.
you truly support a friend, a loved one, an acquaintance. It doesn't matter, anyone with cancer. We just want to be treated like everyone else and, you
Mhm.
know, some sense of normalcy in life.
Yeah, because sometimes the
So,
cancer people tend to like the cancer defines us, like that's you're the cancer girl. Like I became the cancer girl about a year out, and I still am to a lot of people like
yeah.
that maybe aren't so close to me. And I can say that the friends that did help me get through it and stuff, like the biggest thing for me that I really appreciated was them just treating me like I was still a person. Like I was sitting there in the hospital bed, bald and tired and, going through it. And they were still treating me like they usually treat me. And obviously still being like cautious with their words and stuff and being like listening and doing everything that they felt that was best to support me. But what I felt was the best was just feeling like you're a normal person, because sometimes it's hard to remember that you're not just your diagnosis.
Absolutely. Um, and I know that this next question kind of goes a little bit against what we were just saying, but Sharon, I really wanted to get your input on this first. How have your long-term side effects limited your day-to-day ability, and how has it impacted your mental and physical health? Because mental health is just as important, if not more so, than physical health, in my opinion.
Mm-hmm.
Yeah. So, well, like I kind of touched on it, like currently where I live, there's a lot of hills, and my biggest thing is like walking around campus. I lived on campus for the first 2 years of my like college, for my first 2 years of college. And it was like, man, it's like kicking my butt all the time. And that was always kind of a constant reminder of like, I'm just not where I was and things like that. Like, and like thinking back, I also kind of mentioned like I was very active and all that type of stuff. So like there are some things, especially being surrounded in college by like intramural sports and like seeing everyone who's like they're big, they're like buff, they're like so athletic, even if they're not, like a lot of people are kind of like in their, like I kind of mentioned it, physical primes and stuff like that, and it's like, man, like I feel like I'm 30 and like I feel like I'm maybe 30, I don't know, I feel like I'm so old in comparison to these people, um even though I'm not, like, so that was kind of the biggest thing. And like just the day-to-day limiters of like, nah, like no, I can't really like do the big walk around. I mean, I do a lot of choir, and that's like the biggest thing is like we stand
Yeah,
for
a lot of standing.
Mm-hmm.
concerts, right?
Yeah.
We we just did a big work with one of our university's orchestras, and they were like, hey, the orchestra has like this 8 minute long uh thing before you guys start singing. So we're just gonna have you guys on stage, stand up there. And I was like, oh my gosh. I was like, my feet are gonna hurt bad after this.
Mm-hmm.
It's like things like that. And the unfortunate thing is like I still balance. There's a lot of great accommodations I get through the college, which is like the biggest thing. Like we have an office of accessibility and they do so much. It's that balance between like still trying to like, I don't know, because I'm out from treatment, even though I mean, like I said, I'm like 4 years out, which is
Yeah,
great. But there's days where I'm like, man, I like feel like crap. Like,
yeah,
I'm just, I feel old. And that balance between like giving people a hard time about stuff or like being like, oh, like I know I don't look disabled, like, because that's another big thing is like
Mm-hmm.
I thankfully have like disabled car pass, and so like
mm,
I get great parking spots, wonderful, because parking on campus sucks at colleges. Anyways, but it's like trying to balance the like, oh, I'm disabled, like can we like work something out and like let me not just not deal with it. That's been kind of a weird thing, especially because they just don't know. And
Mm-hmm.
if they don't see the big scar on the leg, most people think I broke my leg.
yes.
Like, or I like got in a skiing accident. I don't know.
Mm-hmm.
And like I don't know. Most of the time I can't blame people for that because I don't know. I try not to make everything, and Sam kind of touched on this about like not making like I don't want this to be my identity, especially in college. Like I don't want, even though it's still a thing that affects me,
Mhm.
it's that balance. I feel like I've said that balance a lot. Maybe we can watch this again and we can have a counter. Anyway, start.
Just like in the
But
corner, just one,
like,
two.
it's like I don't
I
someone
mean, it's so
randomly.
true though. Like balancing it, that's very true. Keep saying it because I agree. We all agree.
It's a
Yeah,
tightrope walk. It is.
yeah,
It's
it
Yeah.
fully a tightrope walk. You
yeah.
have it. It's you have it nailed. That's for
Mhm.
sure.
But the other part is like you know I still try to go to the gym a lot, and I still have to do a lot of I do like on and off intermittent fasting.
Mhm.
Try to control like my weight because I feel like I don't look the way I did in high school. And I'm not unhealthy, but I just don't look the same, right? And my dad's like, well, he's like, you weren't going to look the same, freshman, like, gaining weight. He's like, it's all part of life or whatever. So, beside, don't he was like, don't try to just think about it like if the cancer was like the reason for all that. So
Mhm.
I try to do that, and that kind of also helps me balances like a lot of mental health stuff. I felt like I was like great, and I controlled my like I was a very confident little cocky high schooler. Theater kind of does that to you sometimes. But but um
As a former techie, I get it. I
yeah.
was behind the scenes,
so
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 trust me, I know the attitude some of y'all
right.
actors get.
um Not that I wasn't a good I was a nice person. We don't have to dissect all that. But I walked with like an air of confidence, and I even now I still kind of struggle with like my confidence. I struggle with like how I articulate and how I talk. And I feel like that all kind of originates from like I just well, because so this what I was trying to say is I didn't ever feel like I'd have bad days, but I was like, I'm not suffering from like depression, or I'm not anxious. That my freshman year of college, I started skateboarding because I was like, man, I can't bike, but I might be able to skateboard, and like
Mhm.
this is like a thing I want to do. And I did, and like after like 6 months of it, I broke my leg. So I broke the other leg, by the way. Then not that I
No.
my left leg was the cancer leg,
Oh.
the right leg was the broken leg. So that was like a whole
Mhm.
thing, right? So being back in the hospital, I had like anxiety attacks, and I feel so bad for. There was one nurse. I remember on the call light, I was just like, I'm just hysterical right now, and she comes in, she's like, are you okay? What's going on? And I was like, I'm just really sad. Like, and from
That's
there, I was like, I should talk to somebody. I should go through some talk therapy. And so talk therapy has been really helpful for not only unpacking that thing, which was kind of bringing me back to like being back in the hospital, but even post that, kind of the controlling of stress and kind of this imbalance I get from like I very much acknowledge that I have levels of depression every now and then. I don't take any medicine for it. And I went back and forth with my therapist about like, should this be an option? Like, is this the path we need to go? And so she was great about guiding me down of like, you don't have to, you know, if talk therapy is working, it's whatever you feel, and whatever there's a lot of different options. And so
Mhm.
that's a wonderful thing, is that if you are having a hard time, there are so many great options.
yeah.
And I definitely am a big advocate for talk therapy. I was very against like, no, like I don't need to be on medicine. And I was like very negative about it. And even like I was very negative about talk therapy, but it was actually my dad. He was a kind of the same way. But they have a therapist at his work, and she was very helpful for him, and he was a big advocate for me. And so I think even as like a guy and like as a male, it's a big like, well, I'm big and I'm strong and I'm tough, and there's a lot of those kind of feelings, and like it's totally okay.
Mhm.
Um, you know, like so I'm a big advocate for talk therapy. And also, medication, like it definitely, there are so many great avenues to explore for mental health.
Mhm.
So like, you know,
Yeah. There's like a stigma around getting help for mental health stuff. And sometimes you tell people that like you talk to a therapist and they're like, oh, you talk to a therapist like it's a bad thing. It's not a bad thing. I love my therapist. My therapist and
I'm obsessed with mine too.
Christina, if you're watching this, can't wait to talk to you on
I love you.
Thursday. Yeah. Shout out to my therapist, but you just have to figure out what works for you. Like Shashan was saying, like sometimes talk therapy works with some people and sometimes medication works for others, or sometimes it's both. It's all about finding a balance. Uh-huh.
Get
Yeah.
that on the counter.
The
There it is
balance
again.
counter.
Yeah.
Yeah, I mean, it's all really difficult. I mean, Sam, you said it perfectly. There is stigma against mental health, and I when before I had to drop out of school, I was a psych major. I did want to become a clinical psychologist and do like an ABT, just any of the acronyms of therapy to help AYA cancer patients because I know how important it is. And Sean, I just want to tell you how much I appreciate um, you speaking up on it because mental health is so stigmatized, but especially when it comes to men too. And it's like and it never made sense to me. I'm like, everyone should be able to cry regardless of how they identify. You know what I mean? Like it's just you deserve to be as emotional as you want to be because we are human and being human is to feel. And I think before I am, I think therefore I am. So why not, I feel therefore I am.
Mhm.
So I feel like it's when you keep all those emotions in that it really not only does it build your cortisol levels, but which can make your cancer worse, but I mean it can also just make you feel more seen and understood. And I feel like that's one of the gifts of this podcast is that it's not group therapy. None of us are professionals, obviously,
Mhm.
but we all have, even though each of our own cancer experiences is different, we've all had, similar experiences as well that bring us together. We can kind of all bond over the fatigue and how exhausting it can be. And one of my physical effects that really impacted me, they had me on high dose steroids to basically thwart my immune system from attacking my liver. So I was on this great immunotherapy drug that was actually killing my cancer. But unfortunately, it also started killing my liver. And so, Mackenzie, I can relate to you because they didn't even consider putting me on the liver transplant list, but I was getting very close to end stage liver failure back in late 2021. And my LFTs, which are liver function tests, we're not going down. The values we're not going down is very difficult. And when you're on high doses of prednisone for that long, it can really weaken your bones. And so I was also on a lot of other anti-transplant rejection drugs because they were viewing, like my body was viewing my liver as an intruder. Um, so they had me on all these drugs and a lot of them can weaken your bones. And walking is one of my best forms of exercise because it's lower impact, especially if you get shoes like, and again, not sponsored, we're not experts. This is not. I love my Birkenstocks. OOFOS is another great brand, but just any comfortable walking shoe that absorbs impact is going to be great. But I couldn't walk anymore because I kept spraining and or fracturing my right ankle, which is part of my bad leg. um my therapist says I shouldn't call it my bad leg. It should be my expensive leg.
Yeah.
But I kept, spraining or fracturing this ankle. It just kept rolling because, when you take out the support in the knee, it's very hard to control the rest of your leg.
Mhm.
And so I had sprained it this past August and it lit up on my PET scan the following December and it was still hurting. Um, and so after the PET scan, they're like, let's just get some extra x-rays and see what's going on. And my ankle had never healed. And I have osteopenia, which is a precursor to osteoporosis, the other osteo that people know about. And that really impacted my mental health was that I suddenly went from being able to walk and, being able to stand, you know, but that it was limited even before the ankle, and now for it to be limited even more. And again, you know, Sammy, I know you get this living in SoCal or living anywhere where you need to drive, and it's my right
Yeah.
leg, and suddenly my right ankle's out of commission. I couldn't drive for months.
It's
And
difficult.
yeah, so I had to have more metal put in. So I now have about a 3.5 to 4 inch screw coming up through my fibula. Haven't named the screw yet. Any name ideas are greatly appreciated. Um,
We'll brainstorm.
let's just say I got a little bit screwed over by my ankle.
Okay.
And
Okay, puns. You kind of
but
cooked
now
with that
it's
one. I liked it.
yeah, but now it's stable and I can walk again. And another one that I want to touch on, and Mackenzie, please jump in at any point, because I know that you have some of these too, but um the exhaustion from stairs or from anything that's cardiovascularly more intense than just sitting or walking, um, can be really, really difficult and can really make you feel like you're not yourself anymore. And it's a constant reminder. So Mackenzie, I just wanted to check in with you. Like how has the cardiomyopathy and the LVAD and everything that you've been through? Obviously, you know, you're very positive about everything, but how has it impacted your both your mental and physical health? Like what do you feel like are the big major points?
Yeah, I wanted to talk on the stairs thing because we live in a two-story house. So I'm actually downstairs, but it goes stairs upstairs. But we live on a hill, so you walk in. The first story is the upstairs. So I moved to the upstairs in my mom's room with my mom. I switched with my dad because we just have so many stairs, and I was on crutches, and then I was on the walker, and then back on crutches, and then a cane, and then back on the walker. So it was just hard to do stairs at all. And that was just exhausting. So we're like, yeah, I'm just gonna stay up here for a while. I'm finally getting to the point where I'm like, maybe I can move back downstairs, but we'll see. Um, for mental stuff, I think for cancer, I definitely had a lot of survivor's guilt, even though I hadn't even survived it yet. It's just knowing that there's people like on the floor with you that have had it longer, blah, blah, blah. It's just like hard to think about. And then even afterwards, when I survived it, it's like, well, I survived it and this person got it at the same time as me, but they're still going through stuff.
Yeah.
And I got off easy. And then all my hard stuff came, and I don't know if it's kind of a weird mental thing of like, oh, well, I finally got something that levels up to somebody else, you know?
Yeah.
It's difficult to not compare to your experience to other people's. Like
Yeah.
personally, I say so far because you never know, knock on wood. But it was about like a year and a half of my life that like my life was put on pause because I was trying to just focus on surviving. And a lot of the times I hear other people's stories, like right now, unfortunately, like Camille's going through it now for like the 10th time and stuff. And like it's hard, you know, there's guilt, you know, like why is it happening to this person so many times? It only happened to me once. Like I wish I could take that from her because
Yeah.
that's awful. Like I can't imagine. Or like you, Mia, you said that you've been going through it now years, you know, and it's
Yeah.
awful. And then again, the long-term effects, like I don't think cancer is ever done with us. And I
No.
think one thing people don't realize is like, yeah, I'm out of treatment. Like maybe like physically I look okay, but like it's a lot. Like it's something that never leaves you. I still mourn the person that I used to be while simultaneously trying to embrace the person that I've had to become.
Yeah.
So it's just a lot.
You
For
know,
sure.
it's just very difficult because my friends and I have this quote that we say all the time when kind of we don't know what to say, but also just life. Um, and that's we live in a society. And I feel like that answers a lot of questions. Like, I was in a disability studies course and it was called uh, Representation of Disability in Popular Culture. And it was one of the best classes I ever took. And I wrote basically a 12-page roast of The Fault in Our Stars. The movie, not the book. The book does a good job. The movie, however,
Give me spit.
Yeah.
the Fault in Our Stars, there are no scars in that movie. Where are the scars? Why no one has a port? No one has a port.
I didn't even remember, like, because I'd seen that movie before I had osteosarcoma, but I didn't
Yeah.
remember that that was the type of cancer that, like, and then I remember when I was like in, was it in treatment or after or something like that? I like watched it with a couple friends and I was like, hmm, yeah, they
My,
didn't cook with
my
that
mom
one. They
read
really
it.
thought they ate too. And I was like, no,
My
yeah,
mom read the book after I was diagnosed. I was like, don't do that.
don't
I was
read
like,
that.
he
Yeah, it
dies.
doesn't
Like,
end well.
don't do that.
Had something
And
similar with the
she calls me,
LVAD.
hmm?
Have you ever watched Grey's Anatomy?
Yes,
They
sorry,
have
I
an
didn't mean to.
episode with Danny, he has an LVAD, and
Oh, and she cut
Bella
his
Green
wire.
cuts his LVAD wire and basically pumps it manually so that he can get a heart. And I watched it recently with my mom because she wanted to watch it. I'm like, just saying, I warned you, but because I had seen it before I had the LVAD, and when they mentioned it, getting it, I was like, I know what you're talking about, kind of,
Yeah.
but not
I,
really.
yeah, see, cancer representation in the media, that's like a whole other thing.
It
Really,
is.
like, genuinely irks me because I don't think, like, I hate that shows use it too as a plot twist. Like, oh my gosh, like, this person has cancer. And it's like, oh, like, don't use it like that. And then if they do, they usually don't portray it accurately, And
Exactly.
I know maybe it's just because, like, the viewers aren't going to want to see that, but the reality of it is that it sucks. But if you're
Also,
going to
we
talk
don't just
about it, at least
waste.
talk about it correctly.
Yeah.
Hmm.
And we're not just wasting away. Like sometimes people are like that, like if it's really towards the end and they really can't stomach anything. But most of the time, if your providers are doing, what they're supposed to, you're probably
Hmm.
getting a lot of steroids and there's a lot of protective medications, heart protectants, bladder protectants, kidney protectants, there's all these other drugs that they're giving you. Um, but I gained at my heavy, I was 100 pounds, 105 pounds essentially heavier than I was before I was diagnosed at my heaviest point. And I it was really difficult on me mentally because again, I live in LA and we live in a society.
Hmm. We live in a society. Uh-huh.
We are the ages that we are, and social media is such a heavy presence in our lives. We are Gen Z, even though we are the most connected generation, we are known as the loneliest generation, for a reason. And I feel like cancer only exacerbates that. And once you throw in the fatigue and the limitations on what you can do physically due to your disability, um, and any other long-term impacts from treatment, it's it's hard to get the weight off. And
Hmm.
you shouldn't have to feel like you have to lose all this weight. You shouldn't have to feel like you have to, you know, go to the gym all the
Yeah.
time. But it's also something that adds pressure to the prosthetics. So a part of the reason why my bones weren't
Hmm.
healing was because I was on the heavier side and it was, there was constant movement and it just sucked because I was like, well, one of the only joys that I have in life right now is food, and I can't exercise the way that
Hmm.
most people exercise. We're not supposed to do squats, we're not supposed to do lunges. Um,
Hmm.
any single leg standing work is impossible for me because
Hmm.
I can't control Rodney if he's not locked or, like I can't.
It's
There's
dangerous. Yeah.
yeah, and it's, I'm constantly worried I'm going to slip and fall in the shower.
Hmm.
And it's like, I know Sean, you were saying you feel like you're old. I mean, like I'm 25 and I constantly joke around. I've been saying this since I was first diagnosed that I'm like, I was 19 going on 90 because
Hmm.
I, was sitting there and I was just like watching Let's Make a Deal and The Price is Right every morning in the hospital eating pudding. Like I
Uh-huh.
like I literally, with the walker and the cane, I was like, am I really 90? Like, I mean, I'm
Yeah.
a good 90, but am I really 90?
Hmm.
And
So,
the survivor's guilt as well, when you're going through it, like I definitely have gone through it. I mean, I had the whole septic shock thing back in 2021 where that almost killed me. I also had to have not an LVAD wire, but they had to manually monitor my blood pressure. At one point, I spiked a fever of 105.3. And again, these are, all things that have long-term effects on me. Like ever since being on the Lupron, which, some of us, I do want to transition into fertility in a minute. So this is a good segue, but the Lupron shots, I don't know, raise your hand if you had to be on any of the hormone suppressant stuff for treatment, any of the birth controls, any of the anything. Um, I don't know about you, I get hot all the time now. I
oh,
sweat
My God, I get red too, which really makes me mad. Like I do anything and I get red. Like I just get flushed, and it's because I for another long-term effect from like the chemo and stuff. And they said that the birth control too, that can also be something that affects like my like internal temperature, I guess, which
Yeah.
sucks. Embarrassing. I sweat a lot. Oh my gosh, I hate it.
It's very difficult. Sean, I know that you have done a lot of research on fertility options for you in the future, and it is a crucial, it's very important issue in the cancer community when we look upon our future. As more cures, as more treatments are coming out, we are having better survival rates, thankfully, not as quickly as I would like to. But you know, there are plenty of options out there for people, but they can impact our fertility. And so I wanted you to touch on what you've learned and what have you done to kind of determine your options for the future.
Yeah, absolutely. So I will say it's also a very odd thing. I was definitely aware of the fertility issues. I was diagnosed when I was 16. So at the time I was like, and they also said this, my oncologist was like, well, you know, you're 16, so we might not have to worry about this till later. And it wasn't until last year when we did another fertility test and it still didn't like look very good. And where I even at that point I was like, I don't know. I didn't feel the full weight of that. And I remember talking, that was a big thing. I actually talked to my therapist. I was like, I don't know even how to feel about this because I was 20, I was 19 going on 20 at the time, and I was like, I'm still nowhere close to having kids. And I was like, I don't know how to feel about this. I'm 21 now. I'm almost out of college. You know, I plan to have kids in the future, and definitely like, you know, I have a long-term girlfriend, and like, you know, I think about family, and I'm getting to that point where it's like I'm thinking about the future and my career and like family and stuff like that. And so I've gotten into a lot more of like, let's see what's going on. Like, what, you know, now I'm like worrying about it. So, um, which I feel like is hard as a childhood, like childhood cancer. It's like things like that. It's like, well, I'm not, especially because fertility is one that lasts. Like it lasts, oh my gosh, like, you know, you know, you could be immunocompromised because chemo affects us all differently, right? You can be immunocompromised for like 6 months post chemo, or like a year, or however long it takes. Fertility, it's like, man, 10 years, 50, who knows? Like, and the sad part about being a male is there's not as much research done, but there's a lot of great options and there's a lot of great avenues. Um, Adoption's an obvious one, and IVF, or in vitro fertilization,
Mhm.
is a really good one. And especially I was able to, you know, I was able to bank sperm early on, um, you know, before treatment. So you know, we have options about that. I will say kind of I don't know, unfortunate thing is there's not a lot of financial support when it comes to um oh my gosh, chemo brain. Insurance.
Yeah.
There's not a lot of financial supports when it comes from insurance for some of those types of things.
Mhm.
Mhm.
Um like we pay out of pocket to keep the spank sperm and stuff like that.
Mhm.
So which we kind of need to for in vitro and stuff
Mhm.
like that. But the really nice thing is, well, the not really nice thing is adoption in vitro, very expensive. They're not
Very.
cheap at all. Like I said, insurance is hard to cover, but there's a lot of great grants specifically for cancer survivors and cancer patients to help like off put that cost and like help with that. And it thankfully IVF has been like very pretty well researched and it's been very successful. And so there's a lot of that's like that's an option like I'm looking into for in the future. Is something I'm considering. And even if that is unsuccessful, same thing with adoption. There's a lot of great like grants.
Yeah.
You can find financial support outside of that. So that is good. You know,
Yeah.
there is hope, I guess.
Yeah. The insurance thing
Thumbs
is
up with the hope.
crazy. Yeah. I actually like just recently had an appointment with like my primary to be like referred to maybe like a gynecologist, and for that same reason, because they were saying that I should have like get fertility tested, you know, because at the beginning of my treatment it wasn't talked about a lot, and they told me that I should be fine because I'm young and stuff. But then the more I talk to other people, like I've heard that other, and of course I'm 21. I don't have a partner yet, so I'm not thinking of kids for a really long time, but I would like to know if it's possible or like where my chemo and my treatment has left me. And unfortunately, they're trying to refer me to like a gynecologist and like a specialist and stuff, but my doctor was telling me like a lot of it probably isn't covered by the insurance.
Yeah.
So I don't even know. Like, where do we go from there? But like how Sean said, there are different ways and there are different like people that are willing to help you. You just have to look for them. And I don't know. I'm like in the early stages of trying to figure out if I'm barren. But,
There's a bear in you? Sorry.
oh my gosh, no. But like, I don't know. I thought my mom's always like, you're skipping steps. You don't even have like a boyfriend, girlfriend yet. I'm like, but I'd like to know, you know, like
Yeah. I
it's
have
nice.
trouble with that stuff too, just because of my heart. It's like my heart can't even sustain me. It can't sustain another person. And then if I get a new heart, I'll be on this medicine
Yeah.
that will deform anything that I try and conceive. So
Yeah.
giving
No.
birth is not in the plans. So I'd have to look into adoption. But they did say that surrogacy was an option.
Yeah. There are different options. It's just like how Sean said, like unfortunately it's expensive. And unfortunately a lot of it
Yeah.
has to come out of pocket. And that sucks because we didn't ask for this, but we have to deal with it. So
You know, and I promise I'm not going to get too political. I promise. Obviously, you know, it's very difficult in the U.S. as well because reproductive health has become a politicized issue
mhm.
on for all genders. You know, it has become a major issue, and it just sucks because I feel like our generation, you know, with the world that we have inherited, um, there's so much for us that we have to plan for, that we have to save for. You know, it's, oh, you have to save for your, you know, you have retirement and your own college, and what if your parents get sick and they live a long time and they have to come live with you? And so
Mhm.
it's like they're or you know, kids and their college. And so it's this never ending. And you know, unfortunately for the rest of our lives, we are going to need like the highest insurance, you know, that we can afford um to just keep us alive. And that major
Mhm.
sucks. I mean,
It does
it's
suck.
hard thinking about the future. And Mackenzie, I'd love to start with you on this question. You know, how do you navigate those complexities? You know, when people ask you what you want to, you know, what you think your future looks like or the potential of kids, how do you address? Because a lot of people say it meaning well, and unfortunately, you know, as women, you know, we are asked younger usually, you know, do you want to have kids? What's your plan? You know, is your cancer hereditary? How do you handle those questions? You know, because you still are a kid yourself.
Yeah. I don't know. I don't usually get that kind of question. I think it's mostly because it's like family and friends. They're not like thinking of me as a parent yet because I'm so young. But I guess it's just weird, especially because my thing is kind of weird because it's the medicine I'll be on is what's kind of stopping me mostly.
Mm.
And it's kind of scary because like you kind of political, but you've seen in the past where people are trying to like make things like felonies and things like IVF,
Mhm.
you gotta do extra things for, or
Mhm.
if you abortions and stuff like
Yeah.
that. It's like if I have a baby that's not gonna go to term, is that my fault or is it the medicine's fault? And who is gonna pay for that, basically?
Yeah.
Mhm. Yep.
Yeah. It just is a major issue that we all have to face at some point, you know, and
Mhm.
reproductive organs are still part of us. They are still organs. They are still, you
Mhm.
know, things that impact our hormone levels, which can impact, you know, your internal temperatures we were talking about earlier,
Mhm.
your mental health, your physical abilities. You know, there's, you know, so many different things that like when I was on steroids, it really messed with my hormones, and I ended up essentially growing a goatee, and I hated that. Um, because I go in, I get my face sugared every 4 weeks, I get my brows done, I get everything taken off my face, because I just my lineage, I just a hairier person. So
Heavy on the lineage, yeah, bro. Being Mexican, oh, let me tell you, heavy on the lineage. Yeah.
and so you know, it's weird having going from being bald and having no hair to having to get hair removed again. But you know, it's just hard when all these treatments, all these medications, it's like, yes, I'm saved, but what is my future going to look like on these medications? How is my life going to continue? What is my future going to look like? And we are so young to really be thinking of those questions. Like, I think it's already ridiculous that we are expecting 17 and 18-year-olds to already know what they want to do with their lives when they go to college. And I feel like there's so much more pressure on that. And again, I went to a college prep school, so maybe it was that. Where there was a lot of pressure for us to, you know, pick our schools based on what we want to do, and it was a lot more the school makes you, which in reality, it's you make the school, you make what's best of what you have. And I feel like that applies to us in our lives as cancer patients as well, because the only thing we can control is what we do with the information that we're given, and you know, how we manage other people's expectations and our own. So you know, it's just it's very difficult, and yeah, I mean, it's just you know, navigating people's weird questions that come out of left field.
Oh yeah, it's
There's
difficult.
there's a lot of them, and we all have it. And obviously the best thing for us to do is self-care. And so I just, you know, I want to talk to you guys. Mackenzie, we'll start with you again. What is your favorite form of self-care? Like what do you do? You're having a bad day, you're not feeling well. What do you do to cheer yourself up or to make yourself feel better, either physically or mentally?
There's a lot of times where just sleeping helps me a lot. Like if I take a nap, I'll be good later.
Consciousness,
Or
overrated.
listening to music too is really good.
Ooh,
That
yeah.
helps me.
Any Rex?
Ooh, I've been listening to Taylor Swift's new album
The
mostly,
anthology.
but I listen to a lot of Noah Kahan and Hozier, I guess.
I'm going to Hinterland, in Iowa, which is a music festival where Hozier, Vampire Weekend, and Noah Kahan are headliners, but I'm really going for Chapel Roan. So yeah. But yeah,
That's
I agree.
exciting.
Music is definitely great. But so music is your music and sleep are your main two?
Yeah,
Anything else that really helps with the physical stuff?
not really.
Sleep is also physically healing.
Yeah.
Sleep, yeah.
Very important. Sean, what about you?
I definitely think when I'm feeling down, I still I do a balance between surrounding myself with like doing I guess fun things or like just trying to be with people and stuff like that, being with some like close friends and stuff like that. I live with my girlfriend, so we're kind of around each other all the time, and we're able to support each other physically and like emotionally, you know, because we're always around each other, and we have a great relationship, so that can help. Even beyond that, like you know, I have a number of really close friends. So I do find that I'm able to like get like a community and like either watch a movie or just hang out or whatever the case may be, try to get my mind off of those things. And, you know, I have a lot of busy days with school and stuff like that and trying to do stuff like that just to like offset some of those things. The other side is like I do like to sleep. That definitely helps. I'm a musician, so I go to school for music. So in high school, I would do a lot of like music stuff to try to get me off of that. Music is not the same thing it was for me now. I still love music. I absolutely love music, but it's like more of a job than it is a hobby anymore. But so I would say like I used to do a lot of like let me just jam and play guitar or play piano or sing or whatever the case may be. That was like one, but I definitely finding this was a big thing when I first like went into talk therapy and stuff like that is finding the balance between like my work life slash school life and just like my like free time and stuff like that. Um, and like taking being like put stuff on the calendar, put stuff on the schedule of I'm doing this or I'm hanging out with John
Yeah.
or we're gonna go watch this movie at this time or we're going on a date on Wednesday outside of just okay, I know I have school tomorrow and I got this performance that day and I have this due and all that type of stuff. Like make sure you're putting like time that's just you, like outside from the stressing things on the schedule. Make sure they happen. You know, those type of things is like my biggest thing. Physically, uh I use a lot of lotion and a lot of cream on my knee and my leg. I get a lot of knee pain mostly. I also sometimes if I like go to workout or I'm standing around a lot of the day, like I said, I have like concerts where I stand a lot. I wear a knee brace that usually helps. My girlfriend, she's like a fitness instructor, and she was like, you need to use this like compression knee thing. So that is like that's been like the golden goose. That's been awesome.
especially
Um,
on flights. Highly
Yeah.
recommend, especially as
Hmm.
someone who has a history of having a pulmonary embolism from treatment, which is a fancy term for blood clot in the lung. Um, so compression stockings, yes, compression
Hmm.
socks, braces, knees, wrists, elbows, amazing, amazing things because the human body is both a miracle and an architectural nightmare. Um,
yeah.
and then on top of, all the fake parts that we have in us, that keep us going and moving, like some sort of messed up Energizer bunny. But here we are. Um, and I just want to touch on a couple things that I do. Obviously, I am in therapy. I love talking to my friends, going out, but kind of on my terms, just planning ahead really, really helps me, even though that and Sean, I just want to say you said stressor earlier, and I just think that should be a word. I think that absolutely should be a word, and I think it might be my new favorite one. I hope you don't mind if I use that.
Oh no, you
Um,
just got to give me the credit. I mean, I'll
yeah,
get like
I'll be like, I'm just
you.
I'm just I'm just really under stressor right now, Sean. And then
Gotta
it's just
trademark
the
it.
little TM emoji, the little trademark emoji. But yeah, I actually became I'm not teaching currently just because of, physical stuff going on with me and where my treatment is. But I am actually a licensed Pilates instructor, fun fact. And so I did Pilates a lot before I was diagnosed, and there are a lot of low impact exercises that you can do. And as someone with a limb salvage, obviously that is great that I can do things that I couldn't do standing, because reformer Pilates especially is while you're lying down. So, I can go on my side and, just kind of lay down on the side and there's like a bar and it's springs and it's weighted. And so it's like you push your leg against the bar. So it's like you're doing one-legged squats, but it's
Mhm.
not as much weight and it doesn't mess with the joint because it's low impact. So stuff like that makes me feel like I can live a little bit more of a normal life because I can, and getting in the pool as well. Like doing exercises in the pool, I think is really helpful. It's also lower cardiovascularly if you're in the water, just doing some resistance work. So Mackenzie, if you want to get in a pool and get going on
Wish I
that, I feel like that's
could.
going to be fun this summer.
Uh,
You can just get those like little
yeah,
resistance hand things, and you can just kind of and it's fun and
I
it feels
did
like you're
do
Yeah.
like
some.
opening stuff up and just like stretching
Yeah.
and stuff like that, even though there's it hurts for me to kneel because there's not really much padding between the metal of Rodney and the ground. So but it's just finding ways to move that work for you, um but that you don't have to force yourself to, um as well.
I was gonna say I do a lot of PT now, and we just moved it to 3 days a week. I had a surgery not too long ago, and it feels like starting over again. But PT helps a lot for sure. I used to do aquatic therapy before my LVAD, but now I can't do it because it's like toaster in a bathtub, so you can't really
um
do that. But when I get my heart transplant, I'll be swimming.
Yeah, that toaster in a bathtub, that's funny. But
uh so Sammy, you want to wrap up our last question?
yeah, so for self-care, what is it? The compression? You're saying compression everything? I need to be swaddled. I need to find someone to swaddle me because like that helps a lot. Obviously naps. I love naps. We covered this. I sleep everywhere. I like reading a lot. Like I read books. I
Any
read
writing?
romance books because I don't get any real life. So, if I read it, then.
And then I used to really like hanging out with my dog, but unfortunately we had to put her down a
I'm
couple
so
months
sorry.
ago. Yeah, it was tough because she was like my little buddy. Like she got me through cancer and stuff, and it's just I don't know. It was really tough. So I'm hoping that soon after the move, maybe I can rescue another dog because I really like hanging out with pets because I feel like they don't judge us, you know? Like they don't know. They just love us. And yeah, maybe I'll get a cat.
Yeah, get a cat. Get a cat. Cats are lower maintenance. Yeah, we have 2 dogs too, who I love very, very much. But one of our cats lives in my room full time because she's older and she throws up a lot. So obviously we have her throughout the entire house. We're just gonna find mystery piles of puke, like not every day. So it's easier when she's in a confined space. And she's much
Yeah.
happier. It was partially the stressor, TM Sean,
Stressor, yeah.
of her being around her 4 other cats. As she was getting older and she's smaller, they're bigger breeds of cat. So even though she would instigate the fights, she would lose. And so she lives with me now. But anyway, you all have been absolutely amazing. It has been so great to have all of you today. I cannot wait to have you on again. I just want to say to everyone, again, we are not medical professionals. We are just some youngins out here doing our best. These are our personal experiences. Nothing is sponsored. These are all just our own personal experiences. And I want to thank you all for listening, and I want to thank you especially for being here. So everybody, thank you so much for tuning into Osteo today, the Osteosarcoma podcast. Be sure to follow MIB Agents on social media at the links in the description for all of the intel and hot goss. Thank you, Sean, Mackenzie, and Sam for joining us today. You guys have been fantastic guests. I'm so happy you're here. I am your host, Mia, and
That's the tea.